What I take away from the trainings is the impact on so many people who come to our trainings. We've heard so many stories over the years of, I wish I had had this 2 years ago when my significant other family member passed away, whether from intentional overdose or accidental. Just some of the stories you hear of how this could have impacted patients' lives. Just at the end of the day, it's the stories you hear of the impact you're able to have on patients and everyone who comes to the training that you're able to give naloxone to.
Just getting general overdose education out into the public is really important for this area because the opioid epidemic has hit us so hard. So the Eastern Tennessee region is the #1 region in the state of Tennessee as far as opioid overdose deaths go. So again, you never know when an overdose is going to happen. So just trying to get as many people educated and as comfortable in responding to those situations is really important. So Generation RX is a committee under the American Pharmacist Association Academy of Student Pharmacists. So there's a Generation RX committee at every school of pharmacy across the country. And our goal is to educate people on safe medication practices. So we go out in the community and educate on prescription drugs, whether it be opioids or stimulant medications, or we talk to children about how to store their medication safely, so things like that. So naloxone trainings is pretty much what we're known for. Narcan is an opioid overdose reversal agent, so it can bring somebody back to life if they've overdosed on opioids. And we like to go out into the community and train anyone and everyone that we can to use naloxone, how to approach an opioid overdose situation, and how to really save someone's life. We've trained a bunch of other type of professional schools, our medical school, nursing school, our own pharmacy school. We've trained students on the main campus at ETSU, at other colleges around the area. We try to go out and get patients, so we do community ones so that anybody in the community can come and participate in the training. We go to remote area medical clinics where people who don't have health insurance or are underinsured can come get health access there, and we can train them there as well. So we're just trying to get it out to everyone. Here at the School of Pharmacy, we have a ton of volunteers that come out and help us. We have students who have been impacted personally by the opioid epidemic, whether it's a family member or a friend that's been suffering through addiction. We have people who've been on the other side of it, so we even have some students that have worked in EMS and have seen people giving naloxone before. So it's just a really nice experience to have all the different views of people who've received or given naloxone in one place.
So I've been in EMS about 3 years. I started completely uncertified and just got talked into it by one of my friends. I run at Christiansburg Rescue, which is at home for me in Christiansburg, Virginia. I knew I wanted to be a part of GenRx when I applied here because I thought it was really cool what they were doing, but overall EMS, just seeing multiple overdoses throughout my experience with them and realizing how much of a problem it was, it just kind of led me to understand, or to wanting to educate more, because I also have a public health background in education, so it made me want to combine the two really. With the area that we're in and the opioids epidemic that's going on, it was just kind of a no-brainer to combine the two with my experience and wanting to help people and educate them. Just seeing the people afterwards, they actually feel like they can do something and help, and a lot, especially at the RAM clinic, people who had a personal connection with it and had actually seen somebody overdose and had to call 911, they felt like they could actually do something and actually save somebody's life.
Gatton College of Pharmacy has been working with the remote area medical clinics for about 6 to 7 years now, providing opioid overdose education and providing naloxone at no cost to the participants. And so the students work with them to directly train them either one-on-one or in a group setting about risk factors for opioid overdose, how to administer the naloxone appropriately using each one of the steps, and then we provide them with the naloxone to go home with. The students just get such professional satisfaction out of being able to provide this community service. Not only are they learning about naloxone, but they're learning about how to communicate it to other people as well. So they learn their public presentation speaking skills. They learn how to empathize with those that come that have stories of family members or friends that have opioid use disorder or addiction, and just being so scared that one day they're going to have to use the naloxone. And then it's really neat to see them interact with the patients and then be able to come back to school and share with their friends, which really just is the ripple effect, learning about addiction and the opioid use disorder and how pharmacists can be super impactful. That they are just, they're what we call agents of change. They are out there changing our community and saving lives, one education session at a time.